So now we talk about the exchanges. You'll see here on the map, the blue ones are those states that have engaged the exchanges. California has a program called Covered California, and you can go on their website. They have actually a calculator, you can go in there. Has anybody heard about the exchanges? Okay, a few people. It's a marketplace where you can go in and you can purchase your own insurance. I was listening to NPR as I do every single day of my life, and there was a young man that was talking. He says, I turned 26 today, and so that means I can't be covered under my parents' health plan anymore. And the exchanges don't begin till January. I don't even know who's going to be in the exchanges. I don't know how much they're going to cost. But right now, I don't have insurance, and I'm diabetic. So the Accountable Care Act is looking at those individuals that need coverage. And so he's excited and anxious to see how much it's going to cost him and what will be available. So as I mentioned, an exchange is a marketplace. You can go to the exchange and they offer individual and small group markets. So let's talk about what's going on, the new phenomenon, which is employers changing to all part-time employees, like to 29 hours a week. What happens with the exchanges for employers? They are actually penalized if the employee chooses not to use their health plan. And this is kind of a sticky wicket because patients or individuals may find that the exchange premium is less than the premium they have to pay with their employer. If they choose to do that, the employer has a premium up to, I think, $300 or $400 a month that they have to pay the government for that employee. So you can see why, if they are under 30 hours, they're considered part-time employee and they don't have to provide health care coverage. The essential health benefits must include, and this is part of the exchange, ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services, and chronic disease management, pediatric services, including oral and vision care. Now, right now, Medicare doesn't cover dental or vision care. So if you go to their website, which I think is on the next slide, I tried to make it in a different color, but it wouldn't work for me. I don't know why. If you visit coveredcalifornia.com, they have a calculator, so I played around with it. What they've done is they've expanded the eligibility for Medi-Cal, and it's 133% of the poverty level. Does anybody know what the income is to be considered poverty level? It's $10,400 for one individual. If their income is that or less, they're considered at poverty level. So for a family of 2, it's $29,000. Of 3, it's $37,000. Of 4, it's $44,000. And with 5, it's $52,000. Up to 10, which is $90,000, you'd still be considered at poverty level. So if you go in there to the calculator, which I had someone do this, she's a CNA at one of the skilled nursing facilities, and she has 2 dependents. She has coverage through her employer, and then she has to pay for her dependents. So she went in there, she put in her salary and her dependents, and she qualified for Medi-Cal under the exchange. So you know what she's thinking? Well, then I'll just go ahead and sign up for the exchange, and then I won't have to pay through my employer. And you know how that's going to affect the employer. So it's very concerning. You can also go in here and find out about the coverage basics and the frequently asked questions.